Okay, today I'm going to be showing how to insert an IV catheter. So first I'm going to start off, gather all my materials. I have all my stuff right here. And then I'm going to assist my patient. I'm going to let them know what we're doing, and then I'm going to take their vital signs before starting the procedure. When I get my solution and my medication, I'm going to check them, make sure they're not expired, make sure that they're compatible with each other, all that good stuff. And then I'm also going to check my patient, check their name, check their ID bands, make sure everything's matching up with them and the medicine. And then once I get my solution in my bag, I'm going to put a label on there, put my initials, the infusion rate, their name, the time and date, and all that good stuff on there. And then I am going to prime my tubing. So I have my tubing right here. It's already primed. It's hanging up. I got it nice and primed. And then I'm going to go ahead and put on my gloves. This is a sterile procedure, so you want to make sure and try to be sterile once taking all the tops off the needles and everything. All that stuff under there is sterile, so just make sure that. My gloves were backwards in there, but it's okay. Okay, so now that I got my glove on, I have my patient, so I'm just gonna make sure my patient's comfortable. Move my patient a little bit. Okay, and then I'm gonna take my tourniquet. Okay, that would not happen in a normal situation. So I'm gonna take my tourniquet and I'm gonna be giving her needle right here in the middle of the arm. So I'm gonna do that 4 to 8 inches above where I'm inserting my catheter. I'm gonna tie it off. And then I'm just gonna palpate and look for some good veins to insert the medicine into. So after I palpate and find a good vein, I'm going to take the tourniquet off because that can be uncomfortable for the patient. It can stop blood flow. So we're gonna let them take a breather, turn it off, still make sure we have that good, good spot. And then we're going to take our little cleaning swab, clean the area that we plan to insert, and then place that down, and then we're going to put the tourniquet back on and get ready to actually infuse the catheter. So I've tied it off her arm, sorry. And then I'm going to take my needle, and we're gonna do this at a 45, 35 degree angle. I'm just gonna put it in there nice and slowly. And then once we have it in, you're gonna kind of just drop it down to let it lay on the skin. And then you're gonna pull it off. And once you've pulled it off, you're gonna make sure that the needle's stable and everything. And then we're going to take our little dressings. We're gonna apply all them. And we're gonna label these dressings with our initials, the time and date that we placed the catheter. So now that we have that in, she has her catheter in, it's stable and everything, we have the dressing on it, we're gonna take her IV bag and tape it to her so we make sure that it's there. We're gonna assess our patient after we've inserted it, make sure that their vitals are normal, make sure they're comfortable, they have no pain. Yeah, I think that's it.